It's another day in pandemic paradise, and I am feeling optimistic.
Welcome to the other corner of my office, proving once again that we're not on a sitcom set. And also welcome to another day in pandemic paradise, episode 13. My show's Bar Mitzvah, if you will. As such, the Bar Mitzvah gift is a discussion with Illinois House Representative Bob Morgan, who represents the state's 58th district. I should note that this is my second interview with Bob because after recording our first one, I fucked up and accidentally deleted it. Bob's rich background in public health and law made him the perfect interview subject to discuss the pandemic and pot. That's right, Bob is a Cannabis Czar of sorts as one of the state's strongest advocates of medical marijuana. Before he took office, Bob's support helped push the pilot program over the finish line back in 2013, and as a state representative, he made good on his promise to make the program permanent and expand it last year. In the interview that I accidentally deleted, you had discussed your biggest takeaways from your July call with the governor's office to discuss childcare in the age of COVID. School is starting now. Some districts are going with e-learning only, and others a hybrid system, including my district, of in-school and e-learning. What kind of reaction have you been getting on this from your constituents?
It's difficult for everyone right now. I don't think anyone is without some sort of challenge, whether it's for them or a family member or their extended family or their children. Everyone is working through their own scheduling and making sure that we're creating an environment for our kids and our family that's safe, and also as we go back into school mode, accounts for the lack of in-school education that we would normally think of in normal times. The good thing in some sense is that we've had at least weeks, a little over a month, to start to prepare for what is going to be one of the most unique experiences of our lives with regards to school and the changes to that. Every district up here is handling that somewhat differently. We have full remote. We have a hybrid where every student is supposed to be in school at least part of the day, every day, and everything in between. And that is going to be fluid. It's going to be difficult to manage that. And as those things change, that's going to impact parents. It's going to impact childcare. It's going to impact the ways that we're interacting with others and extracurricular activities. And as we get into the winter months, it's going to be more and more challenging.
Yeah, and if I were to be fatalistic, which around us I kind of am, I feel like in many ways this could be a lost academic year. However, a very significant takeaway is that I think students are going to learn how to survive a pandemic.
Certainly, to me, the more difficult challenge will be for high school seniors or college freshmen and college students. Those whose experiences are so greatly impacted by the interactions they're having in their formative years. I have, as you know, a child who's going into kindergarten. This will be but a blip in his life, if he remembers much of it at all. And the reality is our children are resilient, and they're much more resilient than we are. They're not walking around all day fretting about the impact of having masks on, and the impact of thinking about germs in a very scary, harmful, obsessive way. Those are not things that our children are considering or contemplating. It's us.
Yeah, we get to.
We get to. And so I try and put that into perspective. But it is certainly incredibly challenging. And there are a lot of families that are going to have a hard time. They're going to have a hard time emotionally, psychologically, both the parents and the children. It is difficult already for the lack of experiences that we would normally have with our family. Let's focus on the things that are the most difficult right now. Food insecurity, people that are struggling with potential evictions, people who are without jobs who are trying to support themselves and their family. And those are things to me that are the real crisis points. And second from that is how do we support families in all senses of the word? And that's what I've been encouraging the cities and school districts and the park districts to be focusing on. The bigger, more generic, broad-based family support as opposed to just curriculum, right? So that's what I've been working on.
Yeah, and I'm looking at the graph right now on Illinois, tracking the cases, and cases have been increasing, not at a troubling rate, but increasing nonetheless. In your district, how would you characterize the overall response by the different communities?
In terms of the healthcare side of it, or just in terms of actual reaction to the changes?
Actual reaction. Are people continuing to be safe? Or people gotten a little more cavalier?
I think that we're doing about as well as we can do, is how I look at it. In some ways, and I think you and I spoke about this before, this is just a really grand sociology experiment.
Right. How
can we drastically change our culture in a very, very short period of time in a way that doesn't break us as a society? We have a lot of people that are in different parts of the country right now who don't believe that masks can help us. Some of that is rooted in just the distrust of science. And I don't mean that in a judgy way. I just think the science keeps changing on an almost weekly basis. What we know about the transmission of COVID-19 amongst children has changed in just the last few weeks, months. And if you're somebody who has any skepticism about government to begin with, that's just reinforced by the constantly changing guidance. That being said, I think our community has done very, very well. I think the vast majority of our community believes that and understands that wearing a mask, particularly indoors, drastically reduces the spread of COVID. I think there is a human behavior element, particularly amongst young people, feeling invincible that has existed long before COVID, that is going to continue to contribute to all of this, especially as particularly high school and young adults are going to spend more and more time in close quarters, unfortunately, probably indoors as the weather gets colder. That kind of transmission is increasingly where the spikes are coming from, young people.
Right.
But all in all, I think we're doing quite well as a community in taking this very seriously, prioritizing the people and the needs that are the greatest. And I think that's about all we can hope to do right now.
It is, we can legitimately place blame on leaders who have responded very obtusely to this and, very dangerously. I make no bones of that. I mean, obviously the federal response has been poor and has a very decentralized response to where, we've got governors who are, look at Florida, right? I mean, they're going to be at 1 million cases in a matter of weeks because you've got Governor DeSantis who will not mandate masks, who will keep beaches open, and that's hard. It's frustrating as hell.
It really is, and I think a lot about the federal response. As we've discussed before, my background's in public health. I worked at the Illinois Department of Public Health. I spent a lot of time learning about public health policy. And in this particular instance, the biggest failure, as I see it, is the lack of a national testing approach. I just yesterday was talking to somebody who had to wait 2.5 hours at a hospital in their car before they could get a COVID test. And then it's going to be 3 to 4 days before they get the results, which is much better than a lot of states where it's 10 to 15 days before you get a result back. And that lack of national response and that national plan is literally resulting in delayed tests, hesitation about taking the test, skepticism about the test. You saw what happened to the governor of Ohio because he took a test in the morning. It was positive. The test later in the day was negative, which it's not 100% certainty in terms of its testing for any of us. just like any test that we have. But our expectations are so high, and our demands are so high to get out of this, to look for some potential for being done with this pandemic, that it's truly unfortunate, and will take us a long time to dig out from.
And I'm going to ask you to predict the future here, but given
Sure, great, love that.
Given your background in public health, when we do have a vaccine, what do you think it will look like in terms of the state having access to that once it's available?
Most likely we're looking at spring maybe, but probably the summer of next year of 21 for a vaccine possibility. We have moved faster and more expeditiously in an international way for sharing test results and a variety of other ways to make sure the research is going quickly, and we're learning from each other in a multinational, international way. So let's say it happens next summer, where they start producing as much as they possibly can for a vaccine as quickly as they can. I think, knock on wood, we will have a new president at that point. I also think that we, definitely fingers crossed, I think that we will, but who knows? But I think that we will have a new president, and I think from that, you will have a society that in some ways will be forced to come together. And I actually think this is part of my optimism. Once there's a vaccine, as a society, we're going to have to make a decision about who gets the vaccine first. And I think the answer to that will be the same regardless of what state you come from, red or blue. I think it will be seniors, it will be people with pre-existing conditions, and I think that will help us start to reframe this entire discussion in a way that's a national approach, and one that reinforces what our priorities are and our values. Because I think by then it'll probably be clear that while children can spread it, they have a much lower impact in terms of their physical health and much less severe reaction to it, generally speaking. In a really apples and oranges, from a senior or somebody with a pre-existing condition. And I think we're all, whether it's Texas, Illinois, New York, Florida, Oklahoma, I think everybody, once they have access to the vaccine, will approach it in the same way.
Let's talk about marijuana.
Speaking of cures for COVID.
Speaking of nothing newer.
Yeah, sure.
You were instrumental in the creation of the Illinois Medical Cannabis Pilot Program before you were in office, and you were instrumental in the passing of SB 2023, which made the program permanent and added 11 more qualifying conditions, including autism, chronic pain, irritable bowel syndrome, migraines, and more. Where do you want to see the program go from here?
I've always had a goal for the medical cannabis program. Very simply, if somebody needs access to medicine, they get it. We are substantially closer to that ideal today than we were when we started the program in 2014. That happened for a lot of reasons, but partially because in Illinois, in order to expand or change the program, we really needed to go through the legislature. Our law was incredibly narrow at first because that's what it took to pass the law. We almost didn't pass it in the House of Representatives. It was that close. It had to be really, really narrow. We literally treated patients, medical cannabis patients, as criminals because they had to get fingerprinted. People who were 75 suffering from cancer for the first time in their lives were fingerprinted in order to get access to their medicine. We are light years beyond that today. The adult use market and the creation of legalization in some ways took a lot of pressure off the medical cannabis program in treating it like kryptonite and treating it like plutonium and treating it more like the medicine that it really is. There are still people who can't afford it. There's still people who have trouble finding a doctor or a nurse who can certify them. It still takes a little while to get access to the product. There's still places where you're 3 hours away from the nearest dispensary. So there are challenges. But for me, for the medical cannabis program, where I want it to go, I want it to really be treated like the medicine, apples to apples, of any other pharmaceutical medicine that we use.
Right. Do you feel like there is enough physician education and patient education with it?
No, there's far from enough, and that is not a coincidence. That is because of the way that we approach this.
Mm-hmm.
Under federal law, a physician can't prescribe marijuana. So because marijuana is a Schedule I drug under the U.S. Controlled Substances Act, a doctor can't write you a prescription for marijuana. You can recommend it. You can put in your medical record. You can talk to your patient about it, but you can't write a script and take it to Walgreens.
So in lieu of that, you receive your medical card, which is a prescription.
Right, and it's treated a heck of a lot more like a pharmaceutical over-the-counter drug. If you choose Zyrtec or the generic Zyrtec or Sudafed or Benadryl or whatever it is, you choose as a customer over the counter. That's not a physician prescribing it. Marijuana is that, and even more so because it's not using pharmaceutical grade, Sudafed, Benadryl, Tylenol, et cetera. Those are FDA approved drugs that go through decades of research and oversight and quality testing standards, and are governed by billion-dollar pharmaceutical companies, where every single aspirin that you take is exactly the same as the other aspirin you took before. Cannabis, for a variety of reasons, one, it's organically grown, it's coming from a plant, it's not processed, it's hand processed as opposed to mass produced.
Right.
So it's just different. Physicians are never trained about that in medical school. Our understanding of this is also really early stage because the international research on marijuana is so limited because we treat it like a criminal element, criminal product. So education is really lacking where we need to be. We're getting better. We're learning more all the time. But unfortunately, I think we're really far from where we need to be, so that more specifically physicians as compared to the patients and the consumers knowing what they're using. Doctors really don't know how to advise on this yet.
Let's leave it on this question. What's the number one thing you've learned about yourself during the pandemic?
Number one thing I learned about myself during the pandemic. I really enjoy being around other people and having meetings and learning from people and the things they're working on. As an elected official, I was used to spending multiple hours with dozens of people, at least, sometimes hundreds of people a day, hearing about different stuff that's going on and learning about things that I just don't know about and challenges that people are going through that I can try and help with. And during a pandemic, you have to do it over Zoom, like we're doing right now, right? Or you have to do it in a way that you're not physically in the same room with someone. And I miss that. So I think it reinforced what I knew, which is I really enjoy being around people socially. And it forces you to really take stock of the few times where you do get to have a social distance coffee with someone outside, that it has a greater impact and feels a little bit more special than it used to. And I think I take it a little less for granted than I probably did.
Well, there's a lot of uncertainty, but one thing is certain. I am going to download this immediately and save it to Google Drive, so we don't have.
If not, we will do this a third time, dude. I will do this once a week for you.
All right. I won't put you through that. Bob, thanks so much. I appreciate it. Of course. Thanks for giving me a second chance.
I always. And thanks for doing this, and hope everyone gets to listen to your future podcasts too.
For more information, visit bobmorganforillinois.com. In the meantime, be smart, be safe, and give your kids' teachers some love.